Hello everyone, I am Zainab Ifthikar. I am a Sri Lankan and a fourth year medical student at Faisal University in Riyadh, Saudi Arabia. And today I am going to talk a little bit about the COVID-19 pandemic that we are living through. We'll come across what we can do to protect ourselves and our families, also what we should do next if we get the coronavirus. And lastly, we'll talk a little bit about our mental health situation during times of social distancing and isolation. So first of all, we need to know that coronavirus is a respiratory illness and it spreads through something called droplet. So a droplet infection is whenever these small tiny droplets contain the virus and they are spread whenever we cough or we sneeze. Now, either these droplets will directly go from an infected person and enter the respiratory system of an uninfected person, or these droplets could land on surfaces like tabletops, doorknobs, or light switches. And when they are living there, if a normal person comes into contact with that by touching these surfaces, and then without washing their hands, if they touch their eyes, nose, or mouth, they can introduce this virus into their body and then get the infection. So understanding how it spreads is important to know how we can protect ourselves. First of all, do make sure that you are washing your hands thoroughly with soap and water for at least 20 seconds and practice really good hygiene. Do not touch your eyes, nose, or mouth. These are mucosal surfaces and these are entry points for the virus, so avoid touching them. And make sure that you are going outside only when you need some essential goods. And even if you have to go outside, try to wear a mask, or if you don't have a medical mask, at least cover your face with a cloth, a handkerchief, or a scarf, something that will cover your nose and your mouth together. And while you're outside, maintain at least a distance of 6 feet from the other person. That is about 2 arms length. So keep 2 arms length from everybody. And whenever you sneeze or you cough, try to cough and sneeze into your elbow. Don't do it on your hands, because what we do is we touch everything with our hands. So we don't want to sneeze into our hands and then touch everything. So make sure you are sneezing into your elbow. And lastly, keep in mind to disinfect and clean all the surfaces, whether in your house or in your workplace. Again, that could be a doorknob, light switch, a tabletop, and even the groceries that you're bringing into your house. Now, let's say, God forbid, you start to develop the symptoms of the COVID-19, which could be a very high fever or dry cough. So the normal body temperature is about 37 degrees. So if you have a normal thermometer at home and you measure your temperature, you would be able to tell if you have a fever. Generally speaking, a fever of 38 degrees is pretty high. So at that situation, you can take some medication like Panadol. These are known as antipyretics, which is used to break your fever so that you can feel a bit more comfortable. The second thing that happens is dry cough. So there are 2 types of coughs. We have the productive and the dry. Productive means we have mucus coming out as well. So mostly they have seen with coronavirus that patients have dry cough. Now there are other symptoms also that are being reported nowadays, like abdominal pain and something called anosmia. Anosmia means a loss of smell. So they cannot smell anything anymore. So these are just so many different symptoms because this is a virus and it can affect any part of your body, from your heart to your lungs to your kidneys to sometimes even your brain, causing stroke. So the symptoms are very varied, but yes, it is a respiratory illness. So the most common symptoms once again are fever and dry cough. And one of the most common symptoms apart from these is fatigue, which is feelings of extreme tiredness. The first thing that you do is kindly, please, do not panic. Panic is going to stress your immune system and it's going to stress your mental health. So do not panic. And try to stay at home. Do not go outside because you don't want to spread it to your community. So do a service for the community and please kindly stay at home. And if you feel like you have COVID-19, do not go to a hospital or a clinic just as a walk-in patient and request a test. Don't do that, because on your way to that hospital, you will spread it to a lot of people on the way. Instead, if your symptoms get really bad, contact the hotline number in Saudi Arabia, which is 937. This is the coronavirus helpline. And if your symptoms are getting worse or you develop shortness of breath, they will come and get you. Again, the number is 937. And even at home, try to maintain a safe distance with everyone who lives with you. Again, at least 6 feet. Keep your things separate from them and clean and disinfect all the surfaces that you will touch. Also, try to eat a balanced, healthy meal with minerals, vitamins from your vegetables, fruits, and nuts. Take them in adequate, good proportions. And do keep in mind that this is not going to boost your immune system, because general intake of these foods will keep your immune system working at its optimal, which means at its best. So you can take all the nutrition just to feel healthy, just to feel strong. And try to stay as much hydrated as possible. So the coronavirus symptoms can be managed to some extent at home, and try to keep yourself active. Just don't go outside, and maintain social distancing and keep yourself active. Once again, when your symptoms get worse, contact the emergency numbers in your area. Now that we've covered the physical aspects of COVID-19, I would also like to touch a little bit upon the mental aspects that it's affecting. So in these times of social distancing and isolation, a lot of you people out there can find yourselves depressed or anxious, and you might feel very lost. Just keep in mind that whenever you have these feelings of depression or anxiety, immediately reach out and talk to somebody. Talk to someone on the phone, or if you have a family member at home, you can talk to them. Just keep yourself distracted, share your feelings. You can make a prayer, you can make a good meal, and just keep yourself occupied. And always remember that the entire world is facing the same problem, and that you are never alone. In 2016, I established an NGO called the Mei Foundation in Sri Lanka. And our motto is motivation, encouragement, and inspiration to empower any individual to fight the circumstances that they are in. And I think that during this pandemic, these three elements can be very helpful for us to get through difficult times. As we start to move around, go to work, and slowly return to a normal life, it is my kind request to you to continue to practice all the good habits that you acquired during your time staying at home. There is still no vaccine or medication that treats or prevents COVID-19. So when you go outside, do your part. Take the social responsibility of being careful and fulfill your duty. So take care of yourself, and one day we will all come out of this situation both mentally and physically strong. I wish you all good health and stay safe. Thank you.